Firstly, I'd like to thank the Flux Society for the opportunity to present my research, and I also wanted to note that this analysis has progressed since the submission of the abstract back in April, so there will be some inconsistencies with the published abstract. Infants born very preterm are at increased risk of later mental health disorders. In a meta-analysis back in 2011, Burnett and colleagues reported a threefold increase in the rate of anxiety disorders in this population. Reduced volumes in the corticolimbic areas have been reported in cross-sectional studies comparing very preterm children with full-term peers, but it's unclear whether the trajectories of these regions are altered and may help us to understand the high risk of anxiety disorders in this population. As such, the aim of the current study was to compare the developmental trajectories of corticolimbic regions in very preterm children with and without an anxiety disorder at 13 years of age. To assess this, I've used the Victorian Infant Brain Study cohort, which is a prospective longitudinal cohort of infants born very preterm that were recruited from the Royal Women's Hospital in Melbourne, Australia. And they had MRI scanning occurring at the term equivalent age and also at 7 and 13 years of age. Volumes of 16 corticolimbic regions of interest were extracted from T1 weighted images at the 7 and 13 year time points using the Desikin-Killarney Atlas. And volumes were extracted from T2 weighted images at the term equivalent age using the MCRIB Atlas, which is compatible with the Desikin. The presence of an anxiety disorder was assessed at 13 years of age using the DOBA, which is a structured clinical interview. An analysis consisted of a series of linear mixed effects regression models to assess the trajectories of these regions across time by group, which were fitted with a random intercept and unstructured correlation structure. The rate of anxiety disorders in the cohort are presented here, and they were combined into a single group, which comprised of 13% of the cohort, which had one or more anxiety disorder. I've presented the trajectories of growth for each region here with age on the x-axis and volume on the y. And the anxiety group is in red and the no anxiety group in blue. I've also provided the false discovery rate corrected values in the bottom right-hand corner for each region, which are italicized to indicate trends or bolded for significance. The anxiety group displayed significant alterations in the overall trajectories of intracranial volume and total brain volume. When we split this into early and late childhood, we found that growth from 0 to 7 years was slower in the anxiety group in both measures. However, there was no difference in the trajectories at late childhood, so 7 to 13 years of age. And looking cross-sectionally at 0 and 7 years of age, there was no group differences in volumes. The volumes of trajectories of volumes in the corticolimbic regions are presented in figure 3. And we found significant alterations in the trajectories of the right amygdala and the left hippocampus, and trends in the right hippocampus and left medial orbital frontal cortex. And this was again largely due to slower growth from 0 to 7 years in the very preterm group with anxiety. However, there was no difference from 7 to 13 years of age, except for the right amygdala, where there was also no difference from 0 to 7. So when we looked cross-sectionally, there was again no differences from at 0 and 7 years of age. And when we corrected for total brain volume and high social risk, we found that these significant results no longer persisted, and this was mainly due to the influence of total brain volume. So this research suggests that trajectories of corticolimbic growth are altered in very preterm children with an anxiety disorder, especially during early childhood. And next I'll be assessing connecting white matter with whole brain structural connectivity analysis, and also looking into measures of microstructure and macrostructure of the limbic white matter tracts to better understand these findings.